Hey guys, Kati Kleber here to talk resume tips for nurses, specifically for newly licensed nurses. So I'm going to give you 4 tips here. Number 1, I want you to view creating the resume from the perspective of the person reading it. So don't do what I did 10 years ago when I first created my first nursing resume, when I was overwhelmed at the idea and just kind of looked at things online and tried to compare myself. Now, if you are a newly licensed nurse, and let's say you're one of the many who are applying for a residency program, a lot of hospitals will have 20, 30, 50, 70, however many spots for this residency program. Those hiring managers are reading hundreds of applications and hundreds of resumes, okay? So if you can view, you're creating this document that is a highlight reel of who you are, professionally and educationally. That's what this document is, that this person is going to be reading many of them, and you need this piece of paper to speak for you. And also from the perspective of, let's say you get the interview, right? So when you go into the interview, you bring a fresh copy of the resume. Whether or not you were asked to, I would always bring that, just a little tip, because that person interviewing you is also probably interviewing many people. Whether or not they may have read your resume before, but if they just had 3 interviews, they don't remember you. I'm sorry. They don't. There's so many people that it is very difficult to keep track of people, especially if you read their information and resume like 2 weeks ago. Not going to remember you. I'm sorry. I know that sounds kind of not cool because this is like so important to you, but they're interviewing so many people. So always bring that fresh copy of a resume that's like a highlight reel that you can give them, that when you're sitting down and you imagine you're sitting down in the interview and they look at this piece of paper in a matter of seconds and can see, oh wait, you did this and you did, oh okay. And they can quickly and easily tell the things that you've done. Highlight reel of who you are, professionally and educationally. So view it from that perspective of the person who is going to be reading it, both screening for the interview and in the interview as well. Another thing, my second tip, breaking up creating it. So whenever I had to sit down and create my first resume, I really put it off. And then when I got down to the wire and I had to do it, it was very overwhelming and frustrating, and it was hard for me to create a quality resume because I was not in a great headspace. So if you're anything like me, and anything like most nursing students who are overwhelmed and have so many deadlines and so much to juggle, I would encourage you to break up creating a resume, like the task. So maybe you set aside 10 minutes a day for a week, and that's so doable. 10 minutes. So maybe the first day you're going to decide on the formatting and you're going to get the pertinent details like your name, your, and that kind of stuff. And you're going to get your objective statement. 10 minutes, right? Maybe the next day you're going to do the education, your educational experience. Then the next day you're going to do your relevant clinical experience. And then the next day you're going to do your job experience, and then the next day your volunteer. And then the final day you're going to proof the whole thing. And then it's done, right? Over a week, 10 minutes a day, you can completely knock it out and not only have it be done, but also have it be quality. Because every time you have space in between the times that you look at it, and you're looking at it like 7 times over a week, as opposed to 1 time for 3 hours, like you'll be able to say, oh wait, I forgot this. Or, oh wait, this line doesn't match up with that line. Whoops. Or there's this little error here. Like you can catch those errors and things better when you have some time in between when you're looking at it. So 10 minutes a day for a week or 5 days or whatever it might be to make the task more manageable. And I think that's a good principle for any time you have a big task you need to complete, is to break it up into very small and actionable steps. And when you can have these these times where you get something done, you feel like you're accomplishing something and you're getting it done, and it's much more motivating and gets you in a better headspace. So encourage you to break it up. Tip number 3, keep it to 1 page. 1 page. That 1 page. Again, going back to reading it from the perspective or creating it with the mentality of the person who is reading it in mind. If I have to read 3 pages and 2 of the pages is like over explaining things, I can't quickly get through that, right? To have an engaged conversation with you sitting down in the interview, I can't, it takes much more time to go through that. So like, think about this. Let's say you worked as a CNA at a nursing home during nursing school. Pretty common. A lot of people do that. If you list, you know, I was a CNA at this place during this period of time and I had these responsibilities. But what a lot of people do is they overlist the responsibilities. They over-explain their role as the CNA because they want to make them look great. And they, you know, I want to make it look like I had all these responsibilities. Nurses are people, like they, and so are hiring managers. They can read in between the lines, guys. They know what CNAs at nursing homes do. So if you had a typical standard one, you know, you can write maybe a line here about, you know, what you did, but you don't need to like over explain this role that's very common in our profession. So things that would be helpful would be like, how many patients were you taking care of? What kind of a nursing home was it? Was it like, were you doing anything like different that would not be expected? Like, you know, responsible for the, you know, ADLs of 30 patients on night shift or something like that, you know, like that tells me, oh wow, you took care of this many patients, you were on night shift, oh good, you have night shift experience and this is a night shift position or whatever it might be. That is helpful. 6 bullet points under being a CNA at a nursing home, not necessary. Same thing with some clinicals. If you did clinicals at the same hospital and you're over explaining these roles, your clinical roles, like I don't need to know that. I know you did some clinicals, like I don't need to know, like it'd be helpful to know the charting system, how many hours you were there, but I don't need to know that, you know, like 6 different bullet points of every little activity that you did. Like that is unnecessary. So don't go into irrelevant detail and like view that resume as like real estate, high value real estate. The only things that are getting on there are the most important things. So keep that in mind. Finally, prioritize it being organized and functional than it being pretty. Okay, so like there's a lot of resume services out there and things that can make a beautiful resume, but this is not like you're applying for a field in graphic design where your resume design kind of is speaking for your capabilities to in a certain degree. Like it's not that. What's much more important is that you can paint a concise professional picture of who you are in a very organized way, and that speaks to the hiring people more than, okay, you got this accenting color palette and these fonts that look good together, and like, you know, if you're spending 2 hours picking a font, like that's overthinking it, and things that don't, like, make sure it's clear and easy to read and professional, like Times New Roman, you know, that's a great one. If you're, go ahead and do that. Like it doesn't need to be this like very modern and creative kind of thing, right? It needs to be functional and organized, and you should definitely prioritize that and put your focus into the quality of the information that you're putting on there, and not overthinking like text boxes and color schemes and fonts and things like that. So one thing I did was I created a resume template that actually got the approval of someone who does a ton of resumes and reviews a lot of resumes for a nursing residency program. So I have a link to that. It's below the video if you would like to take a look at that, and you can take out a big step of having to worry about all your formatting, and you can just plug in your information there. And also when you receive that, I also go through a couple day emails of some really big resume tips and other things that you can that would be great to avoid doing and things that you should always do. And I even give away my #1 tip of things that nursing students, the mistake that they make on their resumes. So if you click below this video, you can get that resume formatted resume for free, and then you can also hear my top tips. Thanks guys!